Welcome to Social Research Insights. My name is Kamaksha Musnuru. I am Principal Consultant at Social Research Insights. Social Research Insights is not a business organization, it is just a freelance training outfit. We provide training for data science, analytics and IoT. We have a lot of content on our YouTube channel as in the form of the video demonstrations. Entire content is absolutely free. However, we have a small request. You please consider us calling for some staff development or academic development program, faculty development programs. This is in fact one of my video demonstrations which belongs to a series of presentations related to healthcare analytics. In my previous videos I've explained a particular model called Denobadian model. I've demonstrated how to perform the numerical analysis to study and evaluate the model. In this video I'm going to show you how to calculate the capability index, and this is very important index which quite often healthcare organizations or hospitals seek to calculate in order to assess the capability of the services. The capability technically means that the ability of a healthcare institution or maybe organization or hospital demonstrating the services or performing the services to the best interest of the organization, stakeholders and also society. So we can study the capability in terms of several variables. Some of the variables as the ability of the clinical staff, ability of the non-clinical staff, just like paramedical and systems and CRM staff who serve the stakeholders and the customers, just like patients. I mean customer in the sense here healthcare consumer or patient. The capability also refers to the healthcare information systems, the leadership of the systems and maybe in terms of the specializations and the performance of the services as it is demanded by the stakeholders and etc. So in this video I'm going to show you how to use R programming language in order to perform some analysis on some certain data sets. I'm going to simulate the data sets and we are going to investigate what type of data set we have under study. One usual prerequisite for this analysis is that we need to assure the underlying distribution is roughly normal distribution. Not roughly, fairly normal distribution. So then only, because the entire theory of capability index depends on this particular assumption. What I'm going to do, I just follow some certain steps. In the step number 1 I'm going to create or simulate the data sets. The data set represents the number of cases that were handled in a given day, and I see that the data set will be processing number of cases successfully handled by the hospital for 30 consecutive days, and we are going to study the capability of the hospital by performing or calculating the capability index. So please be cautious once again. One of the important requirements for performing the capability index is that we need to assume that the underlying distribution is fairly normally distributed. There are other indices in case if the underlying distribution or the distribution which is under study is not fairly normally distributed. That we'll discuss later in possibly in other demonstration. So step number 1, I'm going to simulate the data sets. Simulation of the data sets, and here since the data set need to be numerical, then I have quite a few wonderful functions in R programming language that help me to simulate the data sets. I'll make use of three important functions, that is absolute, ABS, round or norm. So since I said that the underlying distribution should be fairly normal, I'm going to make use of a function called R norm. My dataset goes like that. Let me give a username to the object which is the data set that I'm going to create, I call cases. So cases left assignment parameter sign, then I should say ABS, which means I am demanding all the values free from the sign, round, then open the bracket, or norm. So this is a function I am using to simulate the dataset. What I am trying to do, I am asking R to return me data points from a normal distribution, so that our assumption will be satisfied for the analysis, or the requirement, our basic requirement will be satisfied for the analysis. Or norm, I'll take some 30 data points, because we need, as I said, I'm going to study 30 the number of cases, successful cases handled by the hospital for 30 consecutive days, and I multiply with 100, so that I'll see that there will be 2 to 3 numerals just before the decimal point, and I don't want the decimal point. This is the, I'll put 0. This 0 is actually belongs to function round. And now let me check my, I think all the parentheses are quite okay. Let me press, yeah, there is no error. Now if I want to see what is there in cases, I can simply press it like this, so that this is just a simple numerical vector. I do one thing, I'll create another function cases1 and convert into a dataset, so that it is easy for me to demonstrate or give a little bit introduction to the as data frame. I think we already have cases, and now I can open this as in the form of a spreadsheet, cases1. Yeah, this is what I am trying to do. So here, if you look at my data set, I told you that these are the number of cases that were handled by the hospital or healthcare outfit or institution, organization, whatever it is. This is the data for the 30 consecutive days, and I'll enlarge it. I think it is, yeah, right now I think it is. Or you can also move the cursor moves. This is just exactly a spreadsheet view, which is inbuilt spreadsheet view of the R programming language. Now getting into the data, we have 26 cases, and the hospital has handled 26 cases successfully in the day 1. Next, immediately after that day, why I took 30 data points, because I just wanted to make sense for a month, so that we have a month data which represents the number of cases that were successfully handled by the hospital. So 44 cases, day 2, 219. You see there is a huge leap between the previous values and the value on day 3, and immediately 30, 100. So this is a hospital. Let us imagine that this is a hospital. There seems to be a huge amount of variance in the data. So number of as usually, like no, we need not have roughly the same number every day. It depends on the specialization. Like this is a hospital. These are the numbers which belongs to all specializations in a given hospital, like diabetics, diabetology, nephrology, cardiology, like ophthalmology, etc., etc., etc. So all put together, 26 cases in the day number 1. 44 cases in day number 2. In day number 3, hospital has handled 219. So 142, and I think 154 is the maximum. 69 still maximum. I think the maximum value is 60. We need not worry about the maximum minimum. We can just go to the editor, and here let us cancel and see the what is the maximum value of the maximum of cases. I think 219. Oh, that's minimum of the cases. 1. Oh, that looks pretty nice. The hospital is well capable of, so as equally as, I mean, the minimum number of cases the hospital handled is 1. The maximum is 219. So there is a huge variation. The hospital is really, I think the initial investigation shows that the hospital is pretty capable of handling the number of cases in spite, because the range is very high. So you can also compute the range as maximum of cases minus minimum of cases. That is going to show the range 218. Obviously 219 minus 1. Okay, anyway, this is not the objective of the analysis. We are going to calculate the capability index, which demonstrates the capability of the hospital in handling the number of cases. Now, before going to do that, let us check our prerequisite whether it is sufficiently normal or not. So, normality check. So, one important technique in statistics is to plot a histogram to check the normality of the data. For that, we have a beautiful function called hist cases, and I make frequency compulsory. I don't want the frequency, which means I want to plot the density. Put the lines. First let me execute this and see what happens. Yeah, but however, if you see we don't have minus 2 plus, so usually we will be having let me show you that, quickly show you the normality graph. Normally the normal graph, normal plot, normality chart or graph looks like this, right? A bell-shaped curve. This is the center, and here minus and here plus, something like that. So this is not that way, right? So in case if you let me put the lines first and say density. We have wonderful methods in order to do all these things. Cases. Color is going to be red. Sorry, control enter. Yeah. Oh, this is not normal actually. Yeah, of course we cannot come to conclusion. So let us convert. Let us take the standard normal variates, which means I'm going to calculate the standard normal distribution. Indirectly, Z distribution for this particular actual observations cases. For that, x minus mu divided by, let me close them in parentheses so that it makes the sense for the numerator. And now x minus mu divided by standard error, right? Standard error is going to be the formula for the standard error. Sorry, things where I should have clear the frame. So standard error is going to be like this: standard deviation divided by square root of n. This is the formula in statistics to compute the standard deviation of cases divided by square root of length of, which means n is the length of cases, number of points. I think I'm correct in doing this. Let me press, yeah, of course, R did not show me. Now we can go for the, you can go back head and Z. Yeah, you got some. Now let us plot this Z values, and then only we'll come to know whether we are correct in our approach. False lines density Z. Cool. I just want to make the line look like in red color. You can use yellow, green, whatever it is. Now it is possible for us to, yeah, it is roughly normal, sufficiently normal, right? So it should be normal. Why? Because I used a function rnorm, which means I requested R to give me 30 random data points from the normal distribution. So it should be normal, but there's a little tinge of the skewness. You see that right skew. Doesn't matter, this is sufficiently normal. So we can go ahead with capability index. And now what is this capability index? Let me tell you that quickly. The capability index is computed in this way. The formula for the capability, let me put it here. Formula for the capability index is going to be upper specification limit minus lower specification limit divided by 6 times standard deviation. Actually, the standard deviation is a hat value, which means it's an estimated value obtained from the sample, not from the population. What is this upper specification limit? USL. USL is actually the upper specification limit, which traditionally calculated the mathematical formula for the upper specification limit as far as the normal distribution is concerned. The mean of the distribution plus Z multiplied standard error. So what is the standard error? I already told you that the standard error, this particular value, standard error, is going to be standard deviation divided by square root of n, which we already did in the n. So what we need to do, we first will try to calculate the x bar, then we try to make our calculations at a 95% confidence level, where the Z value is going to be 1.96. so obviously we'll be multiplying the standard error with the help of 1.96, so that our calculations are available. We'll be making the inferences at 95% level of confidence. So we need a mean, and we already have the standard normal variant value at the 95% confidence level, that is 1.96, and we need to calculate the standard error with the help of SD divided by, SD means standard deviation divided by square root of n. And then we also need estimate for the standard deviation. Now what is going to be the lower specification limit? I just have to replace this plus with minus x bar minus 1.96, which is Z multiplied by standard error. So whatever the value of the error it might be, this is going to be the lower specification limit. So once we are ready with the values, then we'll just substitute those values in the capability index, formula for the capability index. Then we'll obtain this particular index. Okay, so let us do that in action. So first, what we are going to do, we can straight away go for the upper specification limit. This is going to be mean of cases plus, let me start the parenthesis, 1.96. we can also use some couple of functions to make the 1.96 instead of putting it raw, but however that is not they're going to make further complex. Standard deviation of the cases divided by square root of length of cases. I think it is okay. Let me check. You just have to press right arrow button a couple of times to check your usually in R it doesn't matter, because R sets parentheses automatically. Let us press OK. Now let's go to the console and see, yeah, this is upper specification limit. Same fashion, I'll just copy, paste, and change the LSL, lower specification limit, and change this value minus into minus. Enter. Now go to the console and see LSL 49. Okay, I think they're okay now. So what we are going to do, what we did till now, I created an object in our workspace with a name USL, and I computed the upper specification limit, and USL, this which is in uppercase, holds the information of the right hand side calculation, and LSL is another object which I created right now, and it holds the lowest specification limit of our data, and which is the number of cases successfully handled by the hospital. Now let us go to the capability. I simply go to the cap index. Okay, this is going to be, I'll open parenthesis, USL minus LSL divided by, let me open the parenthesis again in order to avoid the conflict, 6 times standard deviation of cases, and I think that is sufficient. So let me press Control Enter. Now we got the capability. Let me go to the console and see what is the capability index. Yeah, 0.11092. That is not, it's a beautiful value, but so let me show you now how to let me tell you now how to interpret this value. Usually the value for the capability index must be greater than 1. Then it shows that the hospital has sufficient capability to handle the issue. So in this scenario, as we are talking about the ability of the hospital to handle the cases successfully, so we can conclude that the hospital really did not have enough capability to handle the cases, because however, that depends on the way we had obtained the data from the information systems or maybe from the survey. It all depends on in this particular data set. The data shows that the hospital lacks sufficient ability to handle the number of cases given the data for 30 consecutive days, which means for a particular month. Since I said we have the underlying distribution which is roughly normal, we can stick to the value. There's nothing wrong with the value and the procedure that we calculated the capability index. We can rely upon the value and conclude that the hospital really lacks the sufficient ability to process the cases. And we did not really know whether these values represents the clinical ability, non-clinical ability, or infrastructure, maybe brand image, or we don't know that actually. These are just raw data, and finally we added some sense saying that the hospital, based on the data, we can conclude that the hospital lacks. The capability index always need to be greater than 1. So which shows or demonstrates the capability of the hospital for a particular and given scenario, which is represented by the data. Okay, in my next video I will try to show you how to handle the issue if the underlying distribution is not sufficiently normal. I hope you like my video. If you like the video, please press like, and kindly don't press dislike or unlike. Stay tuned for the new content. Thanks for watching this video.